What if your child with type 1 diabetes could dramatically reduce the number of insulin shots needed each day? Well, that's a real possibility now because inhaled insulin, known as Afrezza, was recently approved to treat young children, adolescents, and teens. This is huge news. Today, we'll be talking about Afrezza and the INHALE-1 pediatric study with Dr. Anna Cymbaluk, a clinical investigator in the study, Philip, who lives with type 1 diabetes and participated in the study, and his dad, Jim. We'll discuss how Afrezza affected Philip and his family and what parents really need to know about this game-changing therapy. I'm Dr. Steve Edelman, and we are taking control of your diabetes. Hello, everyone. I'd like to introduce special guests today. First, we have Anna Cymbaluk, who is a pediatric endocrinologist at Children's Rady Hospital and an investigator in the INHALE-1 study, the study that led to the approval of Afrezza in kids. And then there's Philip, who was a participant in the study when he was in high school, and now he is an undergraduate at UCSD, and his dad, Jim, a very typical involved parent of a newly diagnosed type 1 diabetic. So we have a lot to cover. Let me just jump into it with you, Anna. Let's start with you, and let's tell our viewers what was the INHALE study, maybe a little bit about the study design so they understand the results, and did it address some of the unmet needs that you see in your patients in clinic?
Yeah, sure. So the INHALE-1 study aimed to compare patients doing basal bolus insulin, both via injection, compared to patients in the Afrezza arm using basal insulin as an injectable, and then the only bolus insulin that Afrezza arm used was inhaled insulin. Those patients used their separate insulin regimens, and they were monitored for side effects and glycemic outcomes, in addition to a slew of other data. The inhaled insulin study addressed a few things, such as obviously glycemic control, making sure that vital signs stayed stable, monitoring for side effects. And then at the end of the study, there was an additional extension period where anyone that had been in the control group was allowed to try Afrezza and extend their time in the trial by being both the control and then a participant.
Now, if you had to sum up the overall results of the INHALE-1 study, what are some of the key results of that study?
So it was set up as a non-inferiority trial, which means it was aiming to just make sure it was the same as the typical MDI regimen. What they did find is that things like pulmonary side effects and hypoglycemia episodes, as well as hyperglycemia, were all very similar between the two groups, so proving safety in pediatric patients. It also, we monitored the inhaled insulin group for their satisfaction of their treatment, and the inhaled insulin cohort was much more satisfied with their diabetes regimens. We also managed and watched things like weight, and there was less weight gain in the inhaled insulin group.
Well, Philip, let me go to Jim first. Philip was just diagnosed as having type 1 not too long before this study was started. And what was going through your mind when you said, oh, I should enroll him in a study that I'm not going to be in, but he's going to be in?
Right. Well, it was my wife, Andrea, that found out about the study. And as I learned about it, it seemed like it might address some of the issues we saw with him. First and foremost was the issue with having to pre-bolus before he eats and, react to the blood sugar levels that happen after eating. And especially when he was in school, dealing with the very short period of time they have to eat lunch. And, just being with friends and trying to eat like them, it was a challenge. And he didn't always want to have every single gram of flour and rice and everything else mapped out for what he would eat. And it just seemed like if he could use Afrezza, based on what I read, because as soon as I heard about the trial, I tried to learn more about the drug.
Yes. It
seemed like it might really address those isses. So
yeah.
we were excited.
Well, we just did a podcast and learned a lot more about Philip. And you were pretty, I hate to use the word compliant, but you were a pretty compliant patient. You did everything right at first. And it sounds like you didn't complain that much. And you entered in the study. And Philip was randomized to the study that had to take injections for the first 6 months, then got switched to Afrezza, and that's when he learned the benefits. Well, tell us how your life changed going from multiple daily injections with sub-Q insulin to taking Afrezza for all your meals and snacks and catch-up doses?
I mean, the big thing about Afrezza for me is that it's just a lot more convenient to use in every aspect. You don't have to wait as long, or really at all, when you eat food. You don't have to think as much about like the timing of when the insulin gets in and out of your system. And then there's just like the speed of using it, just inhaling something versus taking a shot. And then another big thing that I forgot to mention during the podcast was there's just less stuff that you have to carry around with you, because if you have shots, you need the pen, you need the needles, alcohol wipes, sharps container, and then with Afrezza, it's just inhaler and then the insulin cartridges, and you can just like keep that in your pocket if you want to. So everything is easier to do.
A lot of these quality of life benefits are not easily measured in a formal clinical trial. And the clinical trial, INHALE-1, was a formal clinical trial, and the FDA has requirements to get it approved. And they wanted to show that it worked just the same. Well, what about the rapid on, rapid off of Afrezza? Maybe you can explain that a little better and how that affects the blood sugars throughout the day.
It is absorbed essentially immediately when you do your inhalation. It starts working on your blood sugar within approximately 10 to 12 minutes. And its peak onset of action is about 30 to 40 minutes after you do a dose. It's, for the most part, out of your system within an hour, but there can be some lingering for upwards of 3 hours. And so essentially what we recommend to patients is that they can take it up to hourly.
Well, compare that to sub-Q insulin.
Yeah.
So our viewers can say, wow, that's a big difference.
So subcutaneous insulin, you'll hear 3 to 4 hours is sort of the buffer time for an injected insulin dose that's short acting. Of course, when you eat, it takes, sometimes upwards of an hour to be fully in your blood system. And so it does require more pre-bolusing and injectable insulin.
Yeah, and I would say for adults, we educate them every single visit. Take your insulin 20 to 30 minutes before. It's very hard.
Yeah.
And I know you mentioned the podcast that you would actually wait. No one else waited.
He does such a good job.
Yeah, and what happens is the blood sugars go up, and then the insulin eventually causes low blood sugar after eating. And since you do martial arts, that's got to be pretty helpful as well.
Yeah.
Well, let me ask you, Jim. A lot of parents and people think, oh, you can't give something into a growing kid's lungs. What did you think about that? You're a guy that does research.
Yeah, well, as soon as I found out about the trial, the first thing I did was jump on PubMed, a database where you can research the articles, and found out this thing's been around for many years for adults. So there was a lot of information I could find. And, luckily I felt Philip was closing in on adulthood. He wasn't quite there yet, but I felt pretty comfortable from the safety profile of all the studies and articles that are out there that it would be safe for him. And certainly the benefits seem to outweigh potential risk. So.
I think that's key. The benefits outweigh the risk. And as a parent of a kid, your decision also. I can say real briefly before I ask you, Anna, to review the results of the INHALE-1 study. Inhaled insulin was approved in 2014. That's over 10 years ago. And there's been really what we call phase 4 pharmacovigilance. Anytime there's an adverse event, it gets reported to the FDA. So no big issues, no lung cancer, and it's proved the test of time. So maybe you can review quickly what happened in the INHALE-1 study with safety issues.
So during the trial, we monitored baseline lung function in both groups, and then at essentially every research visit, and there were no significant differences clinically or statistically significantly in the FEV1, which is the main pulmonary function marker. There was also no major differences in hypoglycemia events and no major differences in hyperglycemia or DKA episodes.
So it's pretty much being used in anybody like Philip who just wants better glucose control, better lifestyle, quality of life at school, social situations. Who should not use it quickly?
So we don't want patients that have a history of asthma treatment, particularly in the last year. So something to discuss when thinking about starting it. We want to make sure there's been no severe hypoglycemia or DKA episodes in the preceding 6 months, but that's something to continually evaluate as a timeline.
Philip, pull out one of your inhaler and the little cartridge, and to just show the viewers what it looks like.
We have one of the cartridges right here, and then the inhaler. This one. Put it in, and then when this thing comes down, it'll slide back, and then that's kind of the point of no return. So I need to use it right now. Actually, I could use it right now. My blood sugar's pretty high.
Okay, go for it.
And then if you want to muffle the sound, you just grab all the way around it.
Good technique.
And that's the whole thing.
That's
the
about
process.
He's showing off.
Yeah, he's showing off. And I think, a certain percent of people do get a cough when they first start it, but with technique, it can go away. So I think with that, we covered most of the important things. And I'd say to finish it up, Anna, if you were talking to parents of a kid with type 1, what kind of things would you say about Afrezza?
I think I would say that it's known to be safe. It is an excellent option, particularly to just bring up at a visit and talk with your endocrinologist about reasons it may or may not be helpful for your child. Know that your team is always willing to try something new, and it can be a solution to certain things that can make life with diabetes more challenging.
Good summary. Well, I should tell our viewers we're going to have an article in our TCOYD newsletter. We're going to have a podcast, 2 podcasts actually, and some fresh videos. And so I'd say go to your favorite podcast station, as well as, we're on Facebook, LinkedIn, YouTube, TikTok. How's that, Philip, for an old guy naming off all the different
More than I
social
have.
media channels? Okay, well, thank you very much.
Thank you.
Thank you.